Good afternoon, everyone. My name is Angelia Kraft. I'm coming to you from Ashford University. I'm reporting to you about the influenza vaccine that's going awry. Now, I'm talking under the instruction of my instructor, Instructor Abby Stein. And this is a project for the community and public health. And my class is HCA 415. Today I'll be talking to you about the influenza vaccine that has gone awry. Now again, this is for informational purposes only. That's a disclaimer. So now I'll get to the public at hand. Now first of all, before I start my reporting, I would like for everyone to please take the time to listen to this information because this information may save your life and the life of those around you, your loved ones, the people that you go to church with, everybody in your near your circle. So please take this information to heart. And if you experience anything that I speak to you today, please get to your nearest health agency as soon as possible so you can be taken care of. If you are in any of these areas that I'm going to talk to you about as well, please get to someone as soon as possible so we can curb this as soon as possible. Now, what issues that we are going to address first is per the emergency response system, the public please be advised that every step will be taken to ensure everyone in the following areas will be properly and humane cared for. There is a mutated influenza inoculation that was coordinated and researched through a facility that's worldwide, actually a worldwide major agency. Now, I'd like to mobilize the Centers for Disease Control, and we'll call that CDC, to find a solution to this terrible diagnosis of a mutated influenza vaccine outbreak. Now, the mutated influenza vaccine that was distributed this past year, which was, by the way, in September, has metamorphosized. Now, all the inoculations have been deemed tainted. It has been reported that about 50% of the distributed vaccinations have mutated once they have mingled with the human's T cells. We will also work tirelessly to find an appropriate cure before any more loss of life occurs. Now, there have been deaths associated with this mutated vaccine as well. So please, again, be advised. Listen to this information again because this will save your life or someone that's close to you. Now, there's a decision that will also make sure that we will also give you the facts as they are presented to us through the CDC and other involved agencies regarding this matter. Now, the issues regarding paralysis, queasiness, diarrhea, elevated body temperature, and headaches will be thoroughly investigated. Now, these are the symptoms that people who have taken the influenza vaccine that is tainted, this is what they have been experiencing. So if you're having any of these symptoms whatsoever, body temperature going up, you're just constantly nauseated, and you know you haven't taken it, you haven't had anything that's making you nauseated or eaten anything that's making you nauseated. If you're paralyzed, if you can't move your arms, your legs, your fingers, your hands, your toes, if you can't move anything, you have any muscles are locking up on you, anything like that, that is not a normal occurrence. And please get to your medical professional as soon as possible. Again, the CDC is doing everything they can to get to the root of this issue. Now, there are a team of agents that have been assigned to each issue, including interviewing all surviving individuals. Now, there are answers. The answers that the individuals who have taken this vaccine that have given to the CDC, this will further aid in getting adequate answers to this time-intensive area. Now, the health concerns that may arise from this event. Now, here's what we know at this time. The influenza vaccine that has gone awry has accelerated swiftly. Individuals have reported primary manifestations beginning within a 5-day window span. Now, that's 5 days from the time that you actually get the vaccine. this is when you have that 5-day window span. Now, not everyone will experience the same signs and symptoms and indications of illness. Now, during this window, please be advised if you feel any of these aforementioned symptoms, the muscles, paralysis in your muscles, nausea, vomiting, diarrhea, any of those things, please get to your medical professional as soon as you can. Now, also, individual sensory functions will be affected as well. Now, this in turn can cause a person to become, again, immobile. That means you can't move and possibly die. Now, again, not all individuals will face the same signs and symptoms. Again, this is a case-by-case thing. The facts thus far indicate that a total of 256,987 individual cases will see an impact on the sensory systems per reports. Of these totals, 54,267 individuals will expire within a 6-day manifestation period. Now, that's 6 days from the time that you actually get the vaccine until you report those symptoms. Again, not all individuals will face the same prognosis. There have been so many different reports coming into the CDC. Again, this is an individual case, and not everybody's going to have the same problems. There have been numerous reports and numerous tests were performed in order to find out where the inoculation metamorphosized or metastasized, pardon me. The long-term health effects of this event. It has been reported that many individuals will experience paraplegia, meaning you don't have any muscle movement, or remain in a persistent vegetative state where there's no response, like you're in a coma. These numbers of paralyzed patients account for 1% of individuals located in the non-mentioned states. I will mention those states in just a moment. Now, 54,267 individuals, per reports of those individuals who became immobile, account for 21% of the patients. Now, this batch of influenza inoculation was distributed in the fleeting time frame of October the 1st through December the 15th. Now, December the 15th is when the influenza vaccine manifested itself and mutated. Now, a great deal of individuals who were immunized with the daily inoculation have expired or died. Now, again, please take this seriously. Now, what the public health concerns that result from this event are related public health concerns at present are the mutated influenza vaccine could possibly have been related to a bio-terror attempt. Now, this has not been confirmed. Now, please remember, this has not been confirmed, but this does appear to have some of the makings of a bioterrorism type situation, but this has not been confirmed. Again, has not been confirmed. Now, I don't want to alarm you, any of you, but there have been speculations, and there is nothing to support this information at this time. Now, the affected populations is anyone who received the tainted influenza vaccine who live in the following locales. Unfortunately, according to unfolding reports, states that 21 states have been adversely affected by the influenza vaccine. First reports were from the following states that have been affected: Maine, New Hampshire, Ohio, Kansas, Minnesota, North and South Dakota, Indiana, and Iowa. These areas place approximately 45.9 million individuals in harm's way at this emergency's conceptions. This deadly influenza vaccine was originally dispersed to the following states per individual reporting: Maine, Connecticut, Massachusetts, New Hampshire, Rhode Island, Vermont, Illinois, Wisconsin, Minnesota, Iowa, Missouri, Nebraska, North and South Dakota. The human damage has progressively escalated. Now, again, please take all of this information under advisement. Now that you know the facts, please don't panic. The Center for Disease Controls are on the scene, tirelessly working to bring you all more definitive answers and solutions for a cure to this situation. A response team has been dispatched to inform, protect, and contain this situation as per their protocol. The CDC is tirelessly working on an updated influenza vaccine that will hopefully eradicate this mutated virus. The goal is to preserve as many human lives as possible. Now, again, what I want you to take away from this is I don't want anyone to be deterred away from getting an influenza vaccine. The influenza vaccine can save lives. As we progressively get older, our immune system falters and fails. So we need these vaccines that the CDC and other agencies are working towards to get us. We need to take these vaccines to ensure that we have a long, healthy life. So please don't let this mistake deter you for future vaccinations. The vaccinations are important and they will and can save lives. Again, please don't be alarmed, but again, take all of this information under advisement. Again, this is about the influenza vaccine that has gone awry. This is Angelia Kraft reporting from Ashford University. Have a great night.